Hospitals, especially in developing countries, provide more than just medical care for the ill. Their role in preventive medicine is essential. They concentrate an enormous financial investment in diagnostic and treatment equipment, high-tech laboratories and blood banks, and they carry out research on health and medical issues. Hospitals clearly have great social, economic, and political value.
Bueno, básicamente cuando se construye un hospital, sobre todo los más antiguos que tenemos en nuestros países, y cito el caso de Costa Rica, muchos de estos se han construido para un periodo estimado de 20 años. La realidad es que varios de ellos cumplen 100 años. Entonces, desde la perspectiva económica, es una de las obras más complejas y más caras para una sociedad, puesto que tiene que dar los servicios por un largo tiempo y irse ajustando a las nuevas necesidades.
The complexity of a hospital can be seen from its daily activity. In many countries, an average tertiary care public hospital operates 24 hours a day. There are many specialties and hundreds of beds. The occupancy rate is typically over 90%. Counting patients, visitors, administrative, and health staff, a hospital could house more than 1,000 people at any one time. Clearly, this calls for an enormous level of organization and logistic support. Running this hospital requires basic services such as water, sanitation, electricity, and communications. A hospital also houses the radiological, nuclear, chemical, and combustible materials needed to provide specialized services. This complex structure can be affected by unanticipated events, one of which is natural disaster. In Latin America and the Caribbean, more than 8,000 hospitals, that is 50% of the existing stock, are located in areas that are at high risk for natural disasters.
Un terremoto de 8.1 en la escala de Richter ocasionó el derrumbe de 5 hospitales en México.
Provocaron daños en los establecimientos de salud. Estos dejaron de funcionar justo
La
cuando
pérdida hasta el momento asciende a $640 millones.
La red sanitaria dejó de funcionar cuando más de 100,000 personas necesitaban atención médica.
Los ambulatorios fueron gravemente afectados por
19
las fuertes
hospitales sufrieron daños y 6 fueron evacuados completamente.
According to the United Nations Economic Commission for Latin America and the Caribbean, in the past 25 years, direct losses to health facilities caused by natural disasters in the region totaled over $4 billion. When a hospital is destroyed or put out of service because of a disaster, the communities that depend on it are severely affected, especially in developing countries. Frustration and insecurity are a normal response when people cannot receive medical treatment, or when there is concern about patients who were hospitalized at the time of the disaster. These frustrations turn into anger when the population demands medical care and economic resources from its political leaders, resources that must be spent on restoring the services of the affected facilities rather than on urgent, basic needs. The Hyogo Framework for Action, adopted at the Second World Conference on Disaster Reduction in January 2005, called on member states to ensure that new hospitals are built with a level of resilience that strengthens their capacity to remain functional in disaster situations. What is a safe hospital? In a safe hospital, services continue to be accessible and function to their maximum capacity immediately following an emergency, disaster, or other crisis. The continued performance of a hospital protects the people inside the building, the medical care during and after the event, and the investment in the facility.
It is no longer acceptable for healthcare facilities to stop functioning after a disaster, or worse yet, to collapse structurally, hurting or killing the occupants. Pilot projects in the late 80s and early 90s demonstrated that healthcare facilities can be made resistant to natural disaster in developing and developed countries. Today, it is commonly accepted that disaster mitigation is feasible and completely affordable for poor and rich countries alike. Even countries with limited financial resources can serve their populations well by providing them with hospitals and other healthcare facilities that are resistant to earthquakes, hurricanes, and other natural hazards.
Latin American and Caribbean authorities should understand that with the expertise and resources existing in their countries, it is possible to have safe hospitals. This is both a social and economic necessity. Building a new hospital that integrates disaster risk reduction measures can cost the same as building a vulnerable one. The cost of retrofitting an existing hospital can require an investment of 8% to 15% of its original cost. Rebuilding the same hospital after a disaster requires an investment that exceeds 100% of the total original cost. But how can countries worldwide realize the goal of having safe hospitals? Political will is the first requirement. Policies and regulations about having hospitals that can survive disasters will be the basis for preparing national standards, codes, and procedures needed to ensure that a program is in place to protect health facilities.
Construir y adelantar una política sobre hospital seguro en Colombia para un ministerio es un trabajo transversal, es un trabajo de equipo. Hay unas responsabilidades de orden nacional, del ministro, de áreas financieras, de la oficina de desastres de este ministerio, de las oficinas de infraestructura y las que tienen que ver con redes de servicio. Pero también es un trabajo regional y es un trabajo local. Hay también tareas para los gerentes, responsabilidades para los secretarios.
The execution of a Safe Hospitals initiative should be directed at new investments in health and at reducing vulnerability in existing structures. To make sure that a new construction has low vulnerability to a natural disaster, the building or expansion must be located in a safe site, and proper building codes and technical specifications must be applied during construction. Qualified professionals must participate in and assess the project.
Para la construcción de este hospital universitario se han considerado las siguientes medidas de mitigación de vulnerabilidad, como por ejemplo escoger un terreno que es rocoso, en donde la dureza del suelo ayuda mucho. Por otro lado, el diseño estructural es un diseño mucho más exigente que para un edificio de departamento. También existen en la construcción mismo, en los interiores, válvulas de corte de flujo de oxígeno, de gases médicos, de vapor, etcétera, de todo aquello que en un determinado momento pueda romperse y pueda provocar un daño mayor. Todas estas medidas disminuyen tremendamente la vulnerabilidad, porque debemos recordar que un edificio de un hospital, aparte de su alto costo por la complejidad del mismo, es un edificio que tiene que permanecer operando en el momento de un desastre muy grande.
In the case of existing buildings, decisions about which facilities have the greatest need to incorporate risk reduction measures will be made based on an analysis of resources and the performance of the health network. These measures should guarantee the continuity of basic services, protect medical equipment and supplies, and provide stability for architectural elements. It is important to develop hospital disaster plans, prepare and train personnel for emergencies, provide signs in the facility, and carry out a plan for preventive maintenance in the hospital. It is essential to include standards for a safe hospital in the process of hospital accreditation and certification. Several countries in Latin America and the Caribbean have successfully carried out measures to mitigate against damage caused by natural disasters in their health facilities.
El Gobierno Nacional ha venido trabajando desde el Ministerio de la Protección Social en los proyectos que se necesitan para cada uno de los hospitales, sobre todo en lo que tiene que ver con los hospitales de nivel 2 y 3, más o menos el 81% en los nivel 3 y el 62% en el nivel 2. Y ya el 20% de estos hospitales han iniciado sus trabajos propiamente en el reforzamiento estructural para la sismoresistencia. Se han invertido en el año 2005 $1.400.000 en el año 2005, en el año 2006 $4 millones que se van a invertir en las zonas de mayor vulnerabilidad. Esto yo creo que le da la posibilidad a que la comunidad se sienta mucho más segura, con unos hospitales mucho más seguros y de esa manera pues haya mucho mayor confiabilidad.
Mexico, Colombia, Costa Rica, El Salvador, Grenada, St. Lucia, Chile, and Peru, among other countries in the region, know firsthand what can happen to their hospitals in the event of a disaster. They have shown, after the fact, that it is possible to reduce these damages by investing in mitigation measures. The choice made by these countries to invest in retrofitting their hospitals will allow these essential facilities to endure new and unanticipated natural disasters. Health facilities are symbols of social progress and are essential for economic development. Vulnerability of health infrastructure must be reduced. Otherwise, the UN Millennium Development Goals and the goals set out in the Declaration of Hyogo to reduce disaster vulnerability will continue to be out of reach. There must be guarantees that all new investments in health include aspects of disaster mitigation and prevention, and that existing facilities will reduce their vulnerability to ensure that they can continue to perform when they are most needed. This is the responsibility of many sectors and represents a basic political and social obligation. To achieve a safer world, it is essential to build, prepare, and safeguard safe hospitals.